Hello, it's Dr. A, and in this video, I want to spend a few moments providing you with an overview of the cranial nerves. And not only that, I'd like to provide you with some insight on how these nerves can be assessed. In total, there are 12 pairs of cranial nerves, and as we look at the image on your screen, keep in mind that we're viewing the inferior portion of the brain. And the color-coded areas only show where the nerves connect to or extend from the brain. In other words, we can trace the pathway of several cranial nerves to other areas or parts of the body. Now, as we identify each pair of nerves, it's helpful to keep in mind that each is numbered based on its position, from anterior to posterior. Also, these cranial nerves are typically listed according to their Roman numeral. So first we have cranial nerve number 1, olfactory, cranial nerve number 2, optic, cranial nerve number 3, oculomotor, cranial nerve number 4, trochlear, cranial nerve number 5, trigeminal, cranial nerve number 6, abducens, cranial nerve number 7, facial, cranial nerve number 8, vestibulocochlear, cranial nerve number 9, glossopharyngeal, cranial nerve number 10, vagus, cranial nerve number 11, accessory, cranial nerve number 12, hypoglossal. The first cranial nerve is, of course, the olfactory nerve, and in terms of location, we'll find it extending into the nasal mucosa, which makes sense considering there's a direct route here from the nostrils. We can also describe cranial nerves based on their type too. And by type, we're saying there is one of 3 options to pick from. In other words, we can classify each nerve as either sensory, motor, or both. Sensory means that the nerve is related to the senses or that it has a sensory function, while we use the term motor as an indication that the cranial nerve produces some type of movement. And the third option, both, of course, indicates that the cranial nerve has both sensory and motor functions. So for the olfactory nerve, its type is sensory, which is why we can list sense of smell as its function. So to assess the nerve's function, you'd want to start by ensuring that the individual's nasal passages are clear, meaning that there aren't any obstructions. And afterwards, you want to assess their ability to correctly differentiate between different scents or smells. The second cranial nerve is the optic nerve, and as we talk more about it in a moment, it plays a major role in our ability to see. Now, in terms of its location, we'll find it extending from the retina, which is located in the back of the eye, to the thalamus, which is part of the midbrain. So allow me a moment to talk briefly about how we're able to see. Light passes through the eyes to the retina, where it comes in contact with specialized cells that we call photoreceptors. And these photoreceptors are called rods and cones. And from here, the light is transmitted as electrical signals along the optic nerve, where it passes through the optic chiasm and along the optic tract. From here, the electrical signals travel along optical radiations, which is essentially a continuation of the optic nerve, and from here to the primary visual cortex located in the occipital lobe, where its responsibility is to then receive, interpret, and process the visual information that's coming in from the retina. And so in terms of the type for this cranial nerve, we list it primarily as a sensory nerve. And for function, we'll note that it provides us with the sense of vision. Now, to assess whether this nerve is intact or functioning appropriately, we can utilize what's called a Snellen eye chart to determine someone's visual acuity. The third cranial nerve is the oculomotor nerve, and in terms of location, we'll find it extending from the midbrain towards a majority of the external eye or ocular muscles. In terms of its type, it primarily involves a motor response, and this begins to make sense when we consider that its function is to participate in eye movements, that it also regulates the size of our pupils, and that it's responsible for accommodation and proprioception. Now, accommodation is a process that occurs on the inside of the eye, Essentially, it's the process of your lens changing shape, and this is helpful to moderate how the light being brought into the eye is projected onto the retina. The other term I mentioned here that might also need some clarification is proprioception, which in this context represents the fact that we're receiving visual stimuli to help us understand where we are and how we decide to interact with our environment. And in terms of assessing this cranial nerve and its function, there are a number of things that we can do. We can assess whether or not someone's pupils are equal in size. We can also determine if both pupils are round and how they react to light and accommodation. Also, we can assess how well their eyes track to follow a given movement. The fourth cranial nerve is the trochlear nerve, and in terms of location, we'll find it connecting from the midbrain towards the superior oblique muscle of the eye. And because it's connected to this eye muscle, we can tell that its type is going to be motor, meaning that it produces some type of movement. Its function is unique in that it produces a type of eye movement that is not easily seen with the naked eye. Its primary action is to provide a discrete type of rotation. Additionally, it also plays a role in providing us with a sense of proprioception. To assess this cranial nerve, you can determine how well someone's eyes track to follow a moving object, in addition to assessing their sense of proprioception. And there are a variety of ways this can be assessed, and perhaps one of the most common ways of doing this is to ask someone to perform a task with their eyes closed to see how well they can use their joint senses to complete the task. For example, you could ask someone to close their eyes, raise their right hand, and use their left index finger to touch their nose. The fifth cranial nerve is the trigeminal nerve, and in terms of its location, it's pretty expansive. We can trace its fibers from the pons of the brain towards the skin of the head and face, the oral cavity, and even to the teeth. In terms of its type, the trigeminal nerve is described as both, meaning that it provides both sensory and motor functions. And as we follow the nerve fibers to the skin of the face, we'll be able to note the three divisions or branches that are evident. We have the ophthalmic branch, which provides sensations to the top of the head, forehead, the skin over the eyes, and over the dorsum of the nose. Next is the maxillary branch, providing sensation over the temple, cheek, the ala, which is the sides of the nose, and the upper lip. And lastly, for the mandibular branch, we have the temporal side of the head, portions of the cheek, and the bottom lip. So we can list simply for its function that it provides sensations to the head and face, that it also helps produce the muscle contractions necessary to chew our food, and that it also helps provide us with a sense of proprioception. Now, in terms of assessment, we commonly stick to assessing whether or not someone is able to detect touch or sensations to all areas of the head and face, along with asking them to bite down as if they were eating or chewing food. The sixth cranial nerve is the abducens nerve, and in terms of its location, we'll find that it's attached to both the pons of the brain and the lateral rectus, an extraocular eye muscle. Its type is motor, and this is because it's responsible for producing eye movement. And for its specific function, it's primarily involved with producing abduction of the eye, which could also be referred to as lateral eye movement. In addition to producing this eye movement, it's also responsible for providing us with a sense of proprioception. To assess the functionality of the abducens nerve, we would primarily want to assess an individual's ability to move their eyes out to the side or for the ability to be tracked laterally. The seventh cranial nerve is the facial nerve, and in terms of its location, we can trace it from the medulla of the brainstem to the muscles of the face, scalp, salivary glands, lacrimal glands, and to the anterior 2/3 of the tongue. And in terms of its type, it's both, meaning that it provides us with both sensory integration and motor or movement responses. So for its function, the facial nerve provides us with the sense of taste, again for the anterior 2/3 of the tongue, in addition to providing us with the ability to make facial expressions and for the secretion of saliva. And going back for a moment, we mentioned that the facial nerve also supplies our lacrimal glands, and it's our lacrimal gland that's responsible for the production of tears. So to assess the functionality of this cranial nerve, you want to focus on having someone distinguish between various tastes, again on the anterior 2/3 of the tongue, in addition to asking him or her to make various facial expressions such as smiling and frowning. The 8th cranial nerve is the vestibulocochlear nerve. However, it's important to make note of the fact that this nerve is technically the combination of two nerves, the vestibular nerve and the cochlear nerve. It's the vestibular nerve that's responsible for relaying information to the brain about movement and our body's position, and the cochlear nerve connects to the cochlea of the inner ear. And both of these nerves can be traced from the pons of the brainstem to the semicircular canals of the inner ear. In terms of its type, it's sensory. And as it relates to function, the vestibulocochlear nerve provides us with the sense of hearing along with the sense of balance. So the way you want to go about assessing this nerve is through determining someone's auditory acuity, or their ability to hear distinct sounds. Additionally, you could also test their sense of balance. The 9th cranial nerve is the glossopharyngeal nerve, and in terms of its location, we can trace this nerve from the medulla of the brainstem to the pharynx or throat, carotid sinus, and the posterior 1/3 of the tongue. In terms of its type, it's both, providing us with both sensory and motor functions. And in terms of its overall function, it provides sensations of the tongue, provides us with the ability to swallow, the secretion of saliva, the regulation of blood pressure, and our respiration rate. And for a general assessment of this nerve's functionality, you'd want to assess someone's ability to differentiate between taste on the posterior 1/3 of the tongue. Additionally, we could also assess their gag reflex. So let's talk about that for a moment. When we hear the word reflex, what should come to mind is that an involuntary response occurs. And when we talk about the word gag, it's in reference to the prevention of choking. So to assess this, you would take a tongue applicator and touch either the uvula, roof of the mouth, or area around where the tonsils are located. And what we're hoping to see in terms of the reflex is for the throat to contract. The 10th cranial nerve is the vagus nerve, and by far, this nerve has the longest route of nerve fibers out of the 12 cranial nerves. We can say in terms of location that it extends from the medulla to the pharynx, larynx, into both the thoracic and abdominal cavity, where it provides nerve innervation to the lungs, heart, liver, stomach, pancreas, spleen, kidney, colon, and small intestines. In terms of type, it's both, considering that it provides us with both sensory and motor functions. And so a concise description for its function is that it provides sensations and movements to the organs it supplies, along with the contraction of muscles for voice production. To assess this nerve, we want to start by assessing the position of the uvula to ensure that it's appropriately centered within the throat. Afterwards, we want to assess the individual's ability to swallow, speak, and cough. And finally, we can assess their gag reflex as well. The 11th cranial nerve is the accessory nerve, and in terms of location, we'll find its fibers extending from the spinal cord to the sternocleidomastoid and trapezius. And in terms of type, it's motor, considering the fact that this nerve enables movement of those muscles. We can also say the same in terms of the nerve's function, but add to it that it also plays a role in proprioception. To assess the functionality of this cranial nerve, we want to assess the strength of the sternocleidomastoid and trapezius muscles, and we would do this by resisting cervical flexion, extension, and rotation. The 12th cranial nerve is the hypoglossal nerve, and one of the things that's helpful to make note of is the fact that its name gives us an idea of its location too. The prefix hypo, of course, means under, and the term glossal means tongue. So together we can now better understand that this nerve runs underneath the tongue. And in terms of its location, we'd find its nerve fibers traveling from the medulla to the tongue and throat muscles. And as it pertains to its type, we'd say that it's motor. And this is because of its function, which is to provide tongue movement along with a sense of proprioception. So to assess the hypoglossal nerve, we want to first begin by assessing the uniformity of an individual's tongue movement. For example, can they stick out their tongue and then to the sides to the same degree? Following this, we can also assess the strength of their tongue, assessing its resistance to movement. Well, thank you for watching this video. I hope it's been helpful, and I'll look forward to connecting with you again in the next one.